A new study unveils the power of unprocessed eating for healthy aging. A recent study published in Clinical Nutrition has revealed a simple yet powerful strategy for older adults to enhance their health and well-being. The research found that reducing the consumption of ultra-processed foods, UPFs, can lead to significant improvements in both weight and metabolic health. The study, conducted by Professor Mal Day from South Dakota State University, followed 43 community-dwelling adults aged 65 and above over an 8-week period. Participants were provided with a carefully designed meal plan that included both animal and plant-based primary proteins, minimally processed pork, MPP, and lentils, MPL. These proteins were compared to a high UPF, habitual baseline, BSL, diet. The results were impressive. By replacing UPFs with minimally processed foods, older adults experienced a 10% loss of total body fat and a 13% reduction in belly fat. This transformation also brought about a 23% improvement in insulin sensitivity, and participants' daily calorie intake decreased by approximately 400 calories. Professor Day emphasizes the importance of considering the degree of processing when evaluating diet quality. He states, counting nutrients is not enough. The level of processing significantly impacts how the body handles nutrients. Diet quality should be assessed based on both nutrients and the ingredients, taking into account the overall processing level. This study offers a practical and low-risk approach to healthy aging, without the need for restrictive diets. By making simple dietary choices, older adults can improve their metabolic efficiency and overall body composition. The findings highlight the potential of unprocessed eating as a powerful tool for maintaining a healthy lifestyle in later years. But here's where it gets interesting. The study also suggests that the benefits of reducing UPFs extend beyond weight loss. It invites further exploration into the long-term effects of such dietary changes on overall health and longevity. This opens up a discussion on the potential impact of processed food reduction on chronic disease prevention and management. As the research community continues to delve into the implications of processed food consumption, it's clear that a shift towards unprocessed, whole foods could be a key component in promoting healthy aging. This study not only highlights the immediate benefits, but also sparks curiosity about the long-term advantages of adopting a more natural, unprocessed diet.